Hi, I'm Dr. John Groper. I'm a member of the craniofacial team here at Children's Hospital, and also I'm a pediatric dentist in the Division of Dentistry and an attending. And I'm also co-chairman of the nasal-alveolar molding team along with Dr. Simon Gamer, who unfortunately couldn't be here today, but he's usually here. We both work on these patients together. To the left of me is Van Sriracho. Van is my assistant, who's been my assistant for 16 years, 10 of which have been here in the nasal-alveolar molding team. And to her left is Mrs. Susan Abraham with her son, Gabriel Abraham, who at today's is approximately 13 weeks old. And Gabriel is, as you can notice, has got a bilateral cleft lip and cleft palate. This occurs in approximately 1 in 6 patients have bilateral cleft lip and palate. We do not know the reason for the bilateral cleft lip and palate at this time because she has another son who is perfectly normal, has no cleft lip or cleft palate. What we're going to do today is we're going to describe how to take care of the appliance, how to prepare the baby to receive the appliance, how to do taping, and then how to remove the appliance. And then after all that's done, we're going to have Ms. Abraham feed the baby, and we'll just see how everything goes. I'm sure it'll go well because everything up to this point, the last 3 months has gone top flight. So before we get started on Susan explaining everything, I'm going to do the examination. I'm going to put some alcohol on my already clean hands, and I'm going to go ahead and put large gloves on prior to examining Gabriel. Gabriel is one of 2 children. He has an older brother who's 2 years old who has not a cleft lip or cleft palate. We don't know why this is a cleft lip or cleft palate because when I took the history prior to the beginning of treatment, Susan could not ever recall having any issues, health issues regarding Gabriel or any past history of having a parent or grandparent or sister or brother or whatever having a cleft lip or cleft palate. Now, Gabriel has a bilateral cleft lip and a cleft palate. Bilateral cleft lips and palates occur 1 in 6. So the most prevalent cleft lip and palate is a unilateral cleft lip and palate. So I'm going to examine, at this point, I'm going to examine little Gabriel here, and it's not unusual for them to cry. So he's doing his share of crying right now, so I'm just going to go and examine him. I'm looking at the nostrils. This portion is referred to as the prolabium. This here is the premaxilla, and we have the right alveolus, the left alveolus, and we would call his particular bilateral cleft lip and cleft palate as being incomplete. Why is it incomplete? Because the left segment, alveolar segment, is totally joined with the premaxilla, whereas the right segment here has a cleft of approximately 3 millimeters. The cleft on Gabriel actually started out somewhere as close to 10 millimeters. So we have closed this down, almost touching the right alveolar segment, but we are 3 millimeters short. So when the surgeon goes ahead and performs his surgery next week, what he's simply going to have to do is he's going to have to suture or stitch the left portion of the lip and the right portion of the lip to the prolabium. So I don't notice anything in here. There's no irritation underneath in the vestibule or in the nostrils or in the palate. So as far as I'm concerned, he's A1 to go for surgery next week. And Susan, at this point in time, I'm going to have you describe to everyone how to go ahead and apply the base tape, but first how you clean the tissue in preparation for the base tape and the stereotape, and then the placement of the appliance, taking the appliance out, and then going ahead and feeding the baby.
Okay. So So the first thing that I like to do is prepare all of the tape and the material beforehand to make sure that once we start applying the appliance and all of the tape, that it's a quick and swift process for the baby. It really helps if you have someone to help in order to help hold the baby while you're preparing the material and to help you maneuver the baby as well during the process. So this is the box right here in which I keep my supplies. It helps me stay organized and know what I need more material of. They're so gracious as to provide all of this material for me. So what we'll need in order to start, we'll get all of our material out. We'll use this Cavalon. We'll use 2 pieces of base tape. We will need these thin steri strips. We'll need these thick steri strips. Elastic. Mastisol glue. And this little hook. So in order to start preparing the material, we'll start off by creating these pieces right here. And these, we'll need 2 of these, and they will be used to hold the device in place. So to start, you'll want to take 2 of these thin steri strips, one on top of the other. In order to give it some strength. And then you will take a small rubber band. You'll place the rubber band over the top of the double steri strip, and then you'll want to fold over the top to secure the rubber band in place. Then you'll take your scissors and you'll cut a section of the bottom, which you will then use to secure this rubber band in place. Now this piece is ready. We'll create one more. We'll take a thin steri strip and place it on top of another one to create a double. We'll then take a rubber band. We'll slide it over the top. We'll pull back and bend over the top portion. And then we'll cut from the bottom about 1 inch in length. We'll take that piece of tape and use it to secure the top. Three times around. Now we've prepared these 2 sections. The next thing that we're going to prepare is the bow tie that will be applied to his prolabium to help stretch and lengthen it. So in order to prepare that, we'll use the thick steri strips. We'll also want to double them for more strength. So we'll put one on top of the other. And then we'll cut a portion that's about also 1 inch in length. We'll keep that right here to the side as we prepare the bow tie. In order to prepare the bow tie, we need 2 pieces of rubber bands, 2 little elastics. We'll stretch one out and we'll place the other one right in between. Then in order to create the bow tie, you'll keep one side of the bow tie on your left finger and one on the right. And then you'll use your pointer finger and your thumb to take the top of this rubber band and pull it through. Once you have your bow tie, you'll hold it in one hand on two different fingers. You'll take this tape that you've prepared, and you'll want to place it on top of the knot, fold over one of the edges, and then wrap it around like that. And press it to ensure that it's in place. And then at the bottom, you'll create a V-shaped cut, just like that. And then when we apply it into his nose or onto his prolabium, these sections will go into his nostrils. We'll place that to the side. We'll prepare another double skinny steri strip. Just like so. And with this one, what I like to do is fold over this edge in order to help us put it on and then later take it off his face. The last thing that we'll need to prepare is this thick steri strip. We'll need two pieces. About 1 inch in length, and these will be used to secure these pieces on the side of his face. So now that we have all of our materials, we will proceed to put them onto Gabriel's face. All right, to get started, we open up this Kevlar, which is a no-sting barrier film, and we want to dab it onto Gabriel's cheeks, where we're going to apply a base tape. You don't want to rub it, but you want to dab it all along his cheek area. Next, we'll take two pieces of base tape. We'll peel them off the wrapper. And then we want to apply them onto his cheeks at an 11 and a 1 o'clock angle. We want to make sure that when we put them on, we go past this crease in his mouth. We don't want it to touch the crease or to go over. Just like that. Next, we take this double steri strip that we've prepared with an edge on it. We peel it, and we're going to start on the left side of his face. And what we want to do is squeeze his face together. Pulling this tape across his face. What we want to ensure is that this tape does not touch his columella, so it's far away from it, and it's pulling down on his prolabium. Next, we want to put this bow tie with the moustache onto his face. We'll break the moustache plastic like this, and that'll allow the glue to come out to the tip. And we'll dab it. We'll take the bow tie, and we'll place the shape into the middle of his nose. As you can tell, the baby is crying and uncomfortable, so you need another set of hands to help hold him in place. Then you take the Mastisol tape and you reapply on top. You can also take another piece of steri strip and put it right on top to keep this in place. Next, we take our device. Which we've cleaned under just tepid running water. And the way that I insert it is I start with the right side and slide it in after that. You want to ensure that the two side lips are over it and that these pieces are in his nostrils. Now, to keep this device in place, we'll take one of these that we've already created, and along with that, we'll take this piece of thick steri strip, and we'll start on his left side. We'll place the rubber band around this plastic button, and then we want to place this tape at a 1 o'clock angle upward like this. In order to secure both of these pieces of tape, we use this piece of tape that goes across to hold this in place. We'll do the same with the other side. We'll take this and we'll take this. We'll hook this elastic onto this plastic button, and we want to angle this also at an 11 o'clock angle upward with this piece of tape across to secure. Now, the final step is we'll take this plastic hook and we will use it to pull these two pieces of elastic and hook them onto these two plastic buttons. In Gabriel's case, we pulled this one through here and this one to this button. But in every particular case, the doctor will tell you what is the best way to do it. So I'll hook the piece of elastic onto this little hook and pull it around and over this plastic button, and then we'll go to the other side, hook on, and then he's all done. Feeding time. So I usually place the bottle in from the left side of the appliance, ensuring that his tongue is underneath. He's actually grown to really rely on the appliance in order to eat. He uses the retainer portion of the appliance like a palette, and it's helped him. Overall, the process is difficult sometimes because you watch your child cry and you have to, do this on a daily basis, but you end up getting wonderful results, and he's all ready for surgery, and it's going to really improve the overall outcome because of this whole process. So I thank the team here.
Thanks, Susan. I want to thank you, of course, Gabriel, for being such a wonderful patient, and Ben for being such a great assistant, and Dr. Gamer for assisting me and making this all possible.